Hello, everyone, and welcome to the Addressing the Mental Health Toll of Extreme Heat and Wildfire Smoke webinar hosted by the BREE Collaborative. If we have not met yet, my name is Emily Noodleman, and I'm the Director of Implementation and Outreach at the BREE Collaborative, and we are so excited to have each of you join us today as we explore the impact of climate events on mental health. I think this has been a really hot topic recently. We have noticed that I think previously in Washington State and others, we would see extreme heat and wildfire as a season. We're starting to notice in our country, in the United States, that this is occurring year round. And it does really have an impact on mental health. And so through the presentation today, you'll hear from our speaker who will review the signs and risk factors for heat and wildfire smoke driven mental health challenges, discuss the unique vulnerabilities of youth to these exposures, as well as inequitable impacts to the frontline communities that are mostly impacted by extreme heat weather events, and also highlight some pathways for healthcare providers and plans for communication and intervention. For our agenda today, we want to welcome you all to this space. We will provide a little bit of a brief background on the BREE Collaborative, but really spend the majority of our time hearing from our presenter. There is an opportunity for a Q&A with our speaker. If you have any questions for our speaker, please place them in that Q&A box that you should see at the bottom of your screen. We will plan to review those questions and ask them to our speaker during that Q&A portion, and then we'll wrap up. We are really excited about this topic for so many reasons, but one is this presentation really intersects some themes from two of our recent BREE Collaborative reports. This past year, and I think in January 2025, we published one report on health impacts of extreme heat and wildfire smoke, and we also published one on youth behavioral health. In Washington State, we're witnessing more frequent extreme heat days and longer wildfire seasons. These environmental changes can have a wide-reaching effect, not only on the physical health, but also on mental well-being. While we often focus on physical impacts, such as difficulty breathing due to poor air quality or heat exhaustion, it's also really important to recognize the mental health consequences as well. The need to stay indoors, the stress of managing one's health, and concerns about climate anxiety all contribute to a growing mental health burden. Our report on health impacts of extreme heat and wildfire smoke offers some guidance on how various sectors in our healthcare ecosystem can prepare for and mitigate the harm caused by these events. While our report on behavioral health, early intervention for youth, really emphasizes the importance of supporting youth before they experience a behavioral health crisis. These reports are geared towards Washington State, but we really see that anyone and anywhere in the United States can utilize these. I know there's some people on the call today that are from out of state, and we encourage you to also review this work. We are excited to welcome Dr. McKenna Parnes from the Seattle Children's and University of Washington to help share more on this intersection and ways we and the members of the healthcare ecosystem can provide intervention and support to our clients. So I'll pass it to McKenna.
Thank you so much, Emily. It's so nice to be here with you all. I am currently an acting assistant professor at the University of Washington, an investigator in the Truman Katz Center for Pediatric Bioethics and Palliative Care. My background is as a clinical psychologist, and I first moved to Washington State in 2021. So before that, I was in Massachusetts, where extreme heat was something I navigated, but wildfire smoke was fairly new to me. So bringing in my professional experience, but also my own personal experience, having moved to this area to kind of inform some of what I'll be talking about today. So we'll be addressing the mental health impacts of extreme heat and wildfire smoke. Next slide. For the agenda, we'll be going over the signs and risk factors for mental health challenges driven by heat and wildfire smoke. We'll also talk about groups that are most vulnerable to the wildfire smoke and heat mental health impacts. And then I will cover some pathways for healthcare providers and health systems to communicate and intervene on these issues. Next slide. Just to provide some context, between 1971 and 2021, there were an average of 3 extreme heat days per year in Washington State. And what they're projecting is that by 2050, we are going to see this increase from anywhere to 18 to 27 extreme heat days for Western Washington and up to 30 for Eastern Washington. So I am seeing increasingly hotter and drier summers. And what we know also is that this increases the risk and severity of wildfires and wildfire smoke production. So when I came to Washington in 2021, it was the year after we saw some of the worst wildfire smoke in Washington state. I think 2020 was particularly severe. I was warned of smoke season at this time, told to get an air filter. And from my research and what I've looked into, it seems that wildfire smoke and smoke season have actually been more recent events facing Seattle since 2015, though this issue has been faced by other parts of the state for longer, with increasing severity starting in the mid-2000s. I also remember being told when I moved here that I wouldn't have to worry about air conditioning or heat because it was a fairly temperate climate, only to then be exposed to one of the worst heat wave experiences in Seattle in 2021. And I know our counterparts in Eastern Washington experience extreme heat significantly and have for many, many years in other parts of our Northwestern neighbors. So with these changes, we've seen some state level responses, some local responses, especially as we're spending nearly days and weeks of the summer with smoke-filled air and hotter days, especially with the limited infrastructure that we have in some of the parts of the state that we use to respond to these issues that I'm sure are shared also by other states that are nearby. Next slide. So for the most part, there has been an increasing amount of work done to understand the physical health risks of extreme heat and wildfire smoke. These range anywhere from cardiovascular and respiratory health issues, impacts related to dehydration and hyperthermia that affect kidney functioning. We know about heat stress and illness. We also see adverse pregnancy and birth outcomes, with preterm births happening more often during extreme heat events, worsening risk for chronic conditions, skin and eye irritation, and mortality, especially with the extreme heat events increasing. But what about the mental health impacts? I think that this is a newer area of research. We don't have as much evidence that's highlighting kind of the ways in which these link together, but we are increasingly seeing research emerge on these mental health risks of extreme heat and wildfire smoke. And several studies are showing a relationship between how more of these events are related to worse mental health. The work on mechanisms that underlie these relationships is still fairly limited. So a lot of what I'll be talking about today, there's some hypotheses around these mechanisms. There's some work that's being done to understand the consequences of long-term exposure. But I like to just remind everyone, we can often consider mental health risks in the same way that we think about physical health risks. For example, when we're thinking about who is most vulnerable, like people with pre-existing health conditions and people with pre-existing mental health conditions, they'll be disproportionately impacted. So while we don't have as much evidence, I think the frameworks that we use to consider health risks and how we respond are actually fairly similar. Next slide. So to review some of the research that has emerged on these extreme weather events and mental health, we're seeing that both prolonged exposure and acute exposure to extreme heat and wildfire smoke can affect mood. So this is thinking about depression, also mood disorders like bipolar disorder, feelings of anxiety, cognitive functioning, and this is across the lifespan, so starting from early childhood to older adults, sleep, irritability, and violent behaviors, which I think some of actually the strongest research that we have is on this link between extreme heat and increases in violence and aggression. We know that it can affect substance use behaviors, especially people using substances to cope, symptoms of mania and psychosis and increasing hallucinations. We see links between increases in suicidal ideation and attempts. And there's increasingly more work that's showing rates of hospital admissions being higher among extreme heat periods for mental health and behavioral health. And we also see that medication effectiveness and also how medication affects our bodies can have consequences for mental health. One thing that I don't talk about a lot, but I just want to mention is trauma, which is a major consequence, especially of exposure to wildfires, but also extreme heat events that have consequences if we're thinking about mortality or the ways that we're seeing it impact our communities. So I was trying to kind of limit the scope of what I would be discussing, but it's also really critical to keep in mind how exposure to these events can be traumatic, especially when they're leading to a loss of individuals, communities, homes, or economic distress. And that can also have impacts on feelings of grief and loss and thinking about what won't be there in the future. So for the presentation today, I'm not going to be covering all of these topics, but these are just things to be aware of, especially as we see increases in the mental health crisis. I think about this a lot from a prevention standpoint. So we want to work together to prevent our mental health crisis from worsening in ways that are driven by extreme weather events. And I think one of the most helpful things to keep in mind is that, especially with extreme heat and wildfire smoke in this current time, they're fairly seasonal. So we can warn people about these things before they're happening. We can think about the fact that they're potentially going to be worsening and try to build up our systems to be more resilient to that in the future. So it's something that hopefully we can prepare for. Next slide, please. So first, I wanted to just cover the consequences of heat on suicidal behavior, hospital admissions, and other risk-related behaviors. So I tried my best to find research that either summarize this through reviews or meta-analyses or use large samples to characterize this work. So the first study, a review and meta-analysis of 19 studies, found associations between increases in outdoor temperature and associations with attempted and completed suicides and mental health related hospital admissions. We also see how increases in temperatures increase the risk of self-harm behaviors and also increase impulsive behaviors and aggression overall. And in fact, a lot of research on this in particular is coming from East Asian countries that are also increasingly experiencing the consequences of extreme heat events. So for the study that I cited here, it was from Japan, showing that on the hottest days of the year over a 4-year period, self-harm behaviors increased by 11%. Another US study of over 3 million related mental health emergency department visits among adults found that higher summer temperatures were associated with an increased risk of visits for substance use, anxiety, stress, somatoform disorders, mood disorders, schizophrenia and delusional disorders, self-harm, and childhood onset behavioral disorders. This was a study by Nori Sarma and colleagues. They actually used medical claims data to identify the emergency department visits with a primary or secondary discharge of psychiatric diagnoses, and they looked at periods between May and September from 2010 to 2018. This was also a very large sample. It represented over 2,700 counties in the United States. And some of the unique findings that they saw is that these associations were higher actually among men and in the US Northeast, Northwest, and Midwest regions. And this actually may represent just that these areas of the country are less prepared for responding to extreme heat compared to potentially southern regions where heat is anticipated, and they have some infrastructure in place for cooling. And finally, I also saw a review of 83 studies that showed this association between higher temperatures, crime, and violent behaviors. And as I mentioned, we have kind of the strongest evidence for how heat impacts aggression. Some people think that it's that physiological stress and cognitive impacts affect irritability and impulsivity, which then give opportunities for conflict. One of my biggest concerns is thinking through how this really affects our unhoused neighbors. I'll be talking about this more later on, but who are least protected from these events and this increase in the risk of community violence that we can see, and how also these community members are affected by serious mental illness that's characterized by things like hallucinations and delusions, which are worsened by extreme heat, add more risk factors, and then also create, I think, more tension and stress between our unhoused community members and folks that are living in housing and have more economic resources. Also thinking about concerns for women who are most vulnerable to violence and harassment and abuse. There's even some research showing higher rates of intimate partner violence and domestic violence during extreme heat events. So as we're just keeping these things in mind of who is at risk, what do we need to be thinking about and preparing folks for? Next slide. And as I mentioned earlier, extreme heat also has consequences for mood, anxiety, and cognitive function. So a Gallup survey of almost 2 million adults actually over a 5-year period saw that temperatures over 70 degrees Fahrenheit reduced positive emotions like joy and happiness. They increased negative emotions like stress and anger, and also increased exhaustion. So lower energies, feeling tired. And the study found that the individuals who are most vulnerable are those who had less education and were older adults. And I think this is a really good reminder of how we are conceptualizing heat especially since these consequences can begin even at temperatures of 70 degrees Fahrenheit, which I would say we're not all thinking about as extreme heat, but just starting to think about what is the threshold at which heat can start having these impacts. And people believe some explanations for this may be due to how heat stress affects our energy and alter our mental states through these physiological processes that are sensitive to temperatures. But it also could be that individuals have to stay inside for longer periods of time. They're changing their schedules and they're experiencing greater economic strain because of cooling costs. So these are all things to be thinking about and considering in terms of what are the risk factors or potential things that are underlying this association. We also see some consequences of body cooling processes. So the physical symptoms that we experience to cool our body down are things like increased heart rate and sweat that activates the fight or flight response. And this can then increase stress and anxiety. In clinical psychology, there are theories that suggest that our physical symptoms of anxiety are actually what register for us first, and then those drive an anxiety response. So people may not even be feeling anxious about a specific trigger that they could identify, but because their body is experiencing this physiological change, they start to notice symptoms of anxiety that can contribute to distress. We also know that heat affects our thyroid function and hormone production that control things like our mood, our cognition, and feelings of fatigue. And so often there's a question of lag time. So should we be worried about this in the immediate term, or will these effects show up later? And I always say the answer is both. Acute and long-term exposure will have consequences. And this is especially true for the cognitive effects. So one example, thinking about children in the immediate term in schools without air conditioning, which actually that's, I think 36,000, somewhere around there, schools across the country are without air conditioning or have poor air conditioning and heating systems. Children are struggling more in these environments to pay attention. They struggle with memory and impulse control. But we also know that chronic exposure to these events can lead to long-term cognitive impairment. So making sure that people are aware that things can happen more immediately and these consequences can show up later. Next slide. So now moving to the effects of wildfire smoke. The evidence here is not as strong as extreme heat, and I think it really calls for more researchers and scientists to be thinking about this. But we know that from some research, extreme or wildfire smoke exposure can increase feelings of uncontrollable worry. This is often thought of as a sign of mental health concern that can lead to functional impairment that becomes clinically significant. So in this study of nearly 6,000 adults in Oregon, they found that wildfire smoke exposure for 6 weeks or more was associated with a 30% higher prevalence of uncontrollable worry, more than half the time for over 2 weeks. So often, again, in clinical psychology, we're trying to understand what is the impact, how is it affecting functioning, and how long is this lasting for, so that we can really conceptualize the significance of it and how to intervene. And so this, I think, really calls on us to consider how are we protecting communities, especially who are being hit first and worst by wildfire smoke exposure. There's also qualitative research that was done in Washington State, and it shows the effects of wildfire smoke on feelings of anxiety, depression, loneliness, and isolation, feeling a lack of motivation, and a lack of exercise. So thinking about wildfire smoke, similar to heat, can really take away forms of coping, especially for individuals who are living in areas of the country like the Northwest, where outdoor activities are actually a primary source of coping and stress relief. And it can also bring up, as I mentioned before, these feelings of sadness and grief, loss, thinking about how visually seeing smoke represents not only danger to our health, but what is being lost in nature. I think that's something that people are really grappling with. And finally, wildfire smoke and air pollution caused by it can start to affect cognitive functioning within just a few hours of exposure, with attention and concentration being affected in these really acute periods. And scientists are also anticipating that wildfire smoke exposure combined with heat will have significant consequences for infants and children in their cognitive development, as well as challenges to cognitive functioning with an increased pace of symptom worsening in individuals living with dementia. I've actually been writing some grants to explore both the impacts of extreme heat and wildfire smoke on former NICU patients within the first year of life, and just thinking through if there are increased rates of emergency department visits within that first year of life for NICU patients, what are the consequences of exposure, maternal exposure during pregnancy on brain development and lung development, and kind of more research that is needed, but that is signaling to us just from other air pollution exposure more broadly about the real consequences that can last well into adulthood. I think there's even some research to suggest that these early life exposures can lead to increased risk of ADHD, for example. So the point of exposure is really important, and thinking about vulnerability of developing brains. And what this means, even if you're exposed in utero, that it can have these lasting effects. The next slide, please. So now we're going to talk a little bit more about these signs and risk factors, things to look out for. Next slide. So I would say signs to pay attention to. This will be especially important for providers, especially when healthcare providers are working with patients and families. They're hearing about some of these that are emerging, and thinking about the time of year. So often I feel like I liken this to allergy season, where if someone starts reporting symptoms that are aligned with what could be typical in allergy season, you might start educating patients on that relationship and why this might be happening. So someone's like sneezing more, or they're having headaches and they can't really identify why. It's good to provide that education, especially if people are moving to an area where they're exposed to new allergens. I think the same can really be true for extreme heat and wildfire smoke, especially as people, like certain parts of the state and parts of our country have been exposed to this for longer. Certain parts of our state and country are really grappling with these things for the first time. So people might not be aware of these associations. I think another group that can really be thinking about this are schools. So paying attention to what students are showing up, how students are showing up in the classroom, especially on hotter days, or if there is wildfire smoke in the air, or at camp, for example, if it's in middle of summer. And then public health professionals being aware of these signs, both for data collection, so some epidemiological surveys, what questions do we want to be asking and assessing, and also risk communication. So to start going over them, impacted sleep is a huge one. We know that sleep deprivation and poor sleep quality are really major risk factors for mental health problems. And I think probably many of us have heard at some point in our life, when we're thinking about sleep hygiene, the importance of having a cool environment to be sleeping in. But for those of us that are living in areas where air conditioning isn't typical in our homes, or the cost of running air conditioning all of the time is prohibitive, we need to really be thinking about how we can keep ourselves cool, and what we're doing to make sure that our sleep is not affected. And then, as I've discussed, issues with cognitive functioning can be signs and initial challenges that we see. So again, this trouble concentrating, difficulty performing tasks that have not historically been challenging. I think so often this is something that's missed, where all of a sudden someone will just not be able to do something that typically feels really easy for them. And that can be a sign that someone's cognitive functioning is being impacted by heat or wildfire smoke exposure. Or experiencing more confusion, especially for older adults that are already affected by some cognitive challenges. Increases in confusion are potential signs that their symptoms are being exacerbated by these environmental exposures. For behavior, these increases in impulsivity and risk behaviors, irritability, decreased coping, turning to substances, again, as I mentioned, for coping. Another thing that I'll add here is isolation. So often people may be spending less time with their community because of these events, but it might not be so clear. Like if it's really hot outside, someone might be choosing to stay inside for multiple days on end, but they're not really making the point of connection. And in Western Washington, at least, I think we're already so aware of this in the winter when it's gray and rainy outside. So many people are like, what is my plan to stay connected during these really dark periods, I think we need to start encouraging folks to think creatively about what they're doing during other parts of the year and other seasons that may start having consequences for our mental health. So how are we increasing awareness of similar challenges for other types of weather? Symptom changes are something really critical to look out for. There are certain mental health medications like antipsychotics, antidepressants, and mood stabilizers that these actually can increase our heat sensitivity, affect our body's ability to regulate temperature. But extreme heat can also degrade medications and make them less effective or even unsafe to use. So really, healthcare providers need to remind their patients to store their medications in a cool and dry place, making sure that they're really alert and aware of these potential consequences. So if they start to notice any symptom changes or heat-related challenges, encouraging patients to reach out will be really critical. We also can see an onset of new symptoms, as I mentioned before, like feelings of anxiety or overwhelm without a clear cause. This could be our body's response for cooling. And if people start feeling this for multiple days and aren't really understanding why, that can actually increase distress more. And it almost becomes this feedback loop of, I don't know why I'm starting to feel anxious. I can't really pinpoint it. And now it's only getting worse. So making sure we're providing psychoeducation on this relationship between heat exposure or wildfire smoke exposure and these feelings. Symptoms like nausea and eating less, I think wildfire smoke often can affect our physical symptoms, headaches. These can have consequences to mental health and well-being. So paying attention for those new symptom signs. And then similarly, heat and wildfire smoke can both increase feelings of weakness and exhaustion. And there's this feedback loop too of when we're less active and we're not doing the things that we enjoy, we can start to feel even more lethargic and then start avoiding activities because we're not getting the same positive reinforcement that we're used to. And then this becomes a vicious cycle. So making sure to encourage people to find alternative activities and things that can be boosting their mood and just engagement with people they love and things that they love. Next slide. So for these risk factors, this has been coming out throughout, but just to highlight them here more clearly, age is a really big one, starting as early as infants, children and adolescents, and older adults. And kind of what I said in the beginning, for thinking about risk factors, this is not that dissimilar from physical health consequences and thinking often of who is most at risk for the physical health impacts of extreme heat and wildfire smoke. Folks with pre-existing conditions, especially anxiety and mood disorders, schizophrenia spectrum disorders, and other psychotic disorders. These are all groups that are more at risk, both because the medication that they're taking, and as it shows here, that medication is another risk factor, might be affected, but also because their symptoms can be worsened. And then, as I mentioned before, these psychotropic medications can really affect our heat regulation. So thinking about who is on these medications and how are we educating them and what do we need to do to make sure they're able to access ways to help themselves regulate physically or environments. We're talking more and more about things like resilience hubs being created, which I can talk a little bit more about later, but cooling centers. What are we from a public health and education standpoint making sure people are aware of so they know what they have access to within the community to help regulate exposure to these events? Other risk factors are folks that have no access to opportunities for mitigation. So not having opportunities for air conditioning, or air conditioning, again, being too expensive to add in, not living nearby any place that has a cooling center, being able to get somewhere easily, having no air filters during periods of wildfire smoke, which thankfully there's some public health initiatives where filters are being given to people. There are other opportunities where we can teach people how to create box filters themselves. So there increasingly are ways that we can address some of these mitigation consequences, but I think kind of from a policy standpoint, we need to be thinking more about infrastructure of homes and what we're having included, and just making sure that we're setting families and patients up for success well into the future. to not live in environments that are increasing their exposure and causing more challenges. Other risk factors are if you are an outdoor worker, a first responder, or being an unhoused community member, you are just being exposed to these things so much more often. So kind of thinking through, employers, this is something that I think has been suggested of making sure that we're giving ample breaks to people, educating them on what these risks are, making decisions around when people can be out in these conditions versus when it's too unsafe to be out. For unhoused community members, providing access to ice packs, water, thinking about cooling shelters, and first responder programs. I mean, they both are going to just be exposed, especially in the context of wildfires. But what are we doing to protect their mental health and make sure that they have access to services? And there are some places that I've seen that do that better than others. But one really good opportunity, or often university counseling centers have wonderful programs for people to get access to services, and so to sometimes have plugged first responders into those programs. And then living conditions, which kind of ties into the mitigation and being exposed outdoors, but just living in neighborhoods with less greenery and more concrete, living near wildfire zones. These can all pose a lot of risks and challenges. There are increasingly policy efforts for like increasing tree canopy, at least around that we're seeing in Washington. A lot of my wildfire, I guess I would say like friends, I have a lot of folks that work in as firefighters for wildland fires, and they talk a lot about defensible spaces, which is like a way to control and reduce risk and living near wildfire zones. And controlled burns and those kinds of things. So partnering from like a policy standpoint for prevention of exposure, it will be really critical as we move forward. Next slide. So now to think about groups that are most vulnerable to wildfire smoke and extreme heat mental health impacts. Next slide, please. And I've been talking quite a bit about this, but to touch on it a little bit further, I really want to center thinking about age and economic status that relates to these issues. I am a child and adolescent clinical psychologist, so that's really where my expertise lies. And so children's bodies and brains are still growing and developing. Not only this, but they also have less capacity for emotional and physical regulation. They're not attending to their body's cues that alert them to stop physical activities. They can experience differences in air quality and know that something is off, but don't necessarily understand the consequences and the risks. They're also spending way more time outside, out playing sports, being with friends, potentially being unprotected in school buildings. And we've also actually seen research. There was a study from New York City that showed there were increases in mental health emergency department visits for children related to heat exposure, with actually higher rates among Black and Hispanic youth, who we know are often on the front lines of the climate crisis. They're often living in environments that have like an urban heat island effect, where they have less protection from the heat. And so it's much hotter in those parts of the community. And they're really being hit first and worst by climate change. Children, so there are all of those vulnerabilities, but they're also experiencing huge shifts in the activities that they enjoy doing, how they're socializing. And so we need to make sure that when we're planning and strategizing around safety, so if, for example, telling a kid to stay inside if there is more wildfire smoke, or stay inside because it's too hot, we need to also be discussing alternate opportunities for play and connection. So for their indoor sports, can they, if it's really hot outside, can they go to some kind of body of water? What games can be played inside? Are there community centers that they can go to engage in art or connect with peers? Older adults are also more vulnerable. They have probably, they definitely have more difficulty coping with these events, just in terms of thinking about greater isolation. They may not be attuned to the news or aware of needs to evacuate during events. If they're not living near family, this can also pose significant risks and challenges. Their bodies are also less efficient at regulating temperature, and they might be more likely to be on those medications that affect that issue. And then because of the potential isolation and less community support, this can lead to greater feelings of loneliness and affect mood. And then they're already experiencing potentially some cognitive challenges that are worsened, which can feel really scary, potentially unexpected, and contribute to greater distress. But they're not necessarily receiving support or education around why or how this is happening. And this is for, thinking about older adults in so many different contexts. So some who may be living on their own, some who may be in potentially skilled nursing facilities where they have access to support, but there's not education in those environments. Some who are living with caregivers who may not know these associations. So it's really thinking about all of the touch points that we have access to for increasing awareness around this and protection. And then finally, I have been mentioning this quite a lot, but our unhoused individuals and people who are experiencing more economic challenges, they are just facing greater financial burdens. They likely have less access to resources that can provide protection from these events. They also have more exposure to environmental stressors just because of poor infrastructure for building their homes, or in worst case scenarios, lack of housing. So I often say, if we're thinking about our unhoused neighbors, they also might not even be receiving news alerts or education about extreme weather events. Or even if they are, they might be told to go to places like shelters, and these can be like overcrowded or feel really unsafe. And then finally, especially for folks that are unhoused, they're often living and affected by mental health conditions that are really worsened by these events. So certainly experiencing some of the greatest vulnerabilities. Next slide. So now to get into the communication and intervention pieces. Next slide, please. Healthcare providers are a critical point of intervention. We have so much power. We are some of the most trusted communicators. Time and time again, those surveys show up across the US, and that remains true. Oftentimes, nurses are actually highest on that list, even though I think we still have a lot of work to do to build back trust. And I also completely recognize we are already tasked with so many things. So it's a lot of how I try to approach this is not how are we adding more and more things, but how can we almost incorporate this into existing workflows? So if we're talking with patients who have asthma about the consequences of wildfire smoke exposure, how can we fit in one brief sentence about the mental health impacts? Also, as I've been saying, we really need to operate from a place of prevention so that our highest risk patients are not ending up in the emergency department, and that our emergency departments are not overburdened with people during the hottest times of the year or the highest wildfire smoke risk. So these risks are again pretty unique right now because they're seasonal. So as I said, you can think about these ways patients allergy season can start them earlier on. I always recommend leveraging EHR data to help identify our higher risk patients and help these patients establish heat coping action plans or wildfire smoke coping action plans. I think a lot about these discussions too, in very similar ways for incorporating plans around like suicide risk screening and prevention. I think oftentimes many of the things we're trying to incorporate in our workflow have been a challenge. But for patients that we know that are at risk, I think like suicide is a great example. We have to do a safety plan with them if they are really high risk for it. And so I think kind of thinking about heat and extreme heat and wildfire smoke and safety planning is something that's really critical to make sure people stay safe. And also trying to help patients just stay informed. Like, do they know where to get information, weather, how heat and home temperatures, encouraging them to kind of monitor mood or explore changes. And I don't think this is all incumbent upon healthcare professionals to be navigating this. I'll talk about healthcare systems next, but something that we can kind of start thinking about of if there is opportunity to add this in. One of the best things that we can do, and I'm talking with folks about this more and more at my own hospital, Seattle Children's Hospital, is thinking creatively about how to engage subspecialty providers as points of contact to have these conversations with patients. I don't think we can keep adding more to our primary care providers that are often asked to incorporate things and have so little time. But as an example, I have Crohn's disease. I did ever since I was 16 years old. And I would sometimes go to my regular visits with my gastroenterologist, we would be doing a check-in. We'd have 30 minutes scheduled for the appointment, but I would have such little to report because my symptoms were managed. And so that is a wonderful opportunity for that provider to be able to work into the conversation some education around how extreme heat and wildfire smoke could be impacting both physically and mentally. And then our psychologists increasingly and therapists and counselors, I'm seeing 1 or 2 questions added to screeners around how folks are identifying their own risk and kind of thinking about, is that a factor that should be brought into therapy conversations? And especially if you're having a longer session with a patient, you're in a group therapy practice, it can be something that can be worked into the agenda. Another thing I recommend is the Climate RX badge. This is a badge that you can just order for free. You can wear it with your badge that you use, even if you can be a healthcare provider, a public health professional, anyone that wears something. And it provides this QR code for people to just scan and learn about information related to climate and health. So it actually serves as a really wonderful entry point into conversations about these issues. You don't have to necessarily be the person to initiate it, but if one of your patients sees that you have this badge and they ask what it is, that's a really quick, minute or less thing that can then provide them access to a wealth of information about how to protect themselves. Next slide, please. For our healthcare systems, I really think we need to encourage coordination with public health agencies so we can raise awareness about these challenges and the resources that are available. One example is King County offers free air filters. We can share information with people about how to make low-cost air filters at home. I also really encourage adding early identification and screening into electronic health record systems. One of the resources I have on the slide after this talks about the AmeriCares toolkit. They have a checklist for heat and wildfire smoke for administrators, which is a wonderful resource for clinics to think about being prepared for how to respond to this. Crisis hotlines can also be really helpful, provide a clear space for people to know how to respond, especially in the event of disasters. So where I am, we have the 211 line that connects you to local information and referral services. It provides assistance with disaster-related resources like evacuations, shelter, food and clothing distribution, volunteer opportunities. So another thing we can do is even add to those lines awareness of support groups and resources for managing extreme heat and wildfire stressors. And while these events are increasing, there is a wealth of information and support just related to weather-related disasters that have happened, especially thinking about hurricanes that have happened, and the way that we've responded to that crisis response. So we can really tap into those networks too, as we see these extreme weather events increasing related to these heat and wildfire, particularly in areas that aren't used to them. Some other groups that I like making people aware of is the Climate Psychology Alliance. They offer climate cafes, and these are online opportunities for people to plug into and be able to process feelings around exposure to extreme weather and climate change. And they also, I think it's the Climate Psychology Alliance or the Climate Psychiatry Alliance, but one of those groups, they're connected. They provide training in climate aware therapy. I think their next training will be coming up in the fall. So expanding opportunities for clinicians and counselors to engage in climate aware therapy so they can provide more groups. And I believe continuing education credits can be offered, but also more training opportunities with CEs or CMEs would be huge to increase provider knowledge and awareness. We also need to collaborate with community groups and centers who access our most at-risk community members, thinking about really local solutions and local diversity. So what language are we using across contexts? Like some people won't be responsive to climate change, so we don't want to say that. And also whose voices are being represented in solutions we're thinking about. So just to offer one example, I am connected to many mutual aid groups in Washington. I work with a food bank that we take the food that they have left over to address food insecurity. We drop it off in fridges that are located around the Seattle, King County area. And in the summer, I actually put in ice packs and cold water. I carry masks with me in case I see someone who is outside and there's a wildfire event, and kind of try to educate as best as possible around protection. And also have a list of cooling centers in my phone that I can offer to people and share. I think sometimes healthcare systems have donated ice packs, but kind of creating more collaboration between healthcare and community could be really great. And just having info sheets generally shared across public spaces that provide psychoeducation on these risks and solutions. And if you go to the next slide, there are some examples of these sheets that are shared. These are from the Climate Psychiatry Alliance. So how we're supporting youth after a wildfire with books and links and resources, and then ideas on surviving a heat wave. The next slide, I have just the list of resources I mentioned. I think these are really wonderful. AmeriCares is great. Climate Psychiatry Alliance has many toolkits. The EPA and CDC have some resources on coping with stress of wildfire smoke, and then engaging with local advocacy and lobbying groups who are thinking about policy to try and reduce these risks is really important. And the final slide, I have the Climate RX QR code if you are interested in getting a badge for yourself, and my email. And I'm also just going to share a link to evaluation potentially in the chat that folks can kind of give me feedback on this presentation if you're willing. So thank you so much.
Emily, you're on mute.
I thought I just noticed that. Thank you. I was just saying thank you so much, McKenna. We are grateful to have you with us today. We will enter the Q&A portion here. There's a couple questions in the chat, and one is, how do you think partnerships can be developed between local public health departments and mental health providers and other care providers? The individual works at a local public health department and would love to share this information with their providers.
I think this is where, and I've attended these like interdisciplinary forums and workshops to really facilitate practices of knowledge sharing. I think what's one of the best things we can do. I partner really closely with folks that work in King County, Seattle Public Health. We're actually working on projects together collaboratively. So I would say just creating these peer support and communication networks. There are some that you can plug into, and depending on where you are, I can also try to offer support in finding them, but if not, just building them out and having speakers come, I think, from these different sectors to share their expertise would be really, really helpful.
Yeah. There's also a question in the chat, are climate cafes appropriate for teens?
There are increasing climate cafes that are teen focused. I think they're really wonderful resources. One of the teens that I've actually worked with before started climate cafes in New York City, and increasingly are doing it with their peers. So I would say that there are some that are certainly youth focused, and that's increasing more and more, and some that are actually even youth led with adult support. So I think it's a great opportunity for teens.
Thanks. You highlighted a lot what could be done by healthcare providers and clinicians, healthcare systems. I'm curious too if you have any insight on what health plans might be able to do to help support their clients kind of in this space.
Yeah, I think that health plans actually have a really unique position. They can adapt their coverage to include extreme weather support in what they're already offering. So increased access to therapy for individuals that are experiencing distress after they've been exposed to extreme weather events. Also collaborating with the community organizations, public health agencies, and schools to kind of develop and implement these more focused programs on supporting mental health in the context of extreme weather. But I think kind of this coverage piece is really key. And so even if we're thinking about, like, firefighters are one of my best examples, or young people that are living in areas that could experience an urban heat island effect, like what are we thinking about in terms of the healthcare coverage that is offered to them, and what we can be doing to provide some like prevention and protection.
Thank you. A question came in the chat too, is how can we best create community education programs on prevention, adaptation, resilience to heat and smoke events? Can this education take the work away from many healthcare providers when appropriate?
I think so. You know, a lot of actually the work that I do is much more outside of my healthcare system that I work in, and it's with communities. So there are I would say in every state I've lived in, and I've lived in many places across the country, there are environmental organizations, and they might not be the experts on the healthcare side of these things, but they're constantly providing community education on the environment and mitigation strategies. And so if we could provide our expertise to them and almost build capacity of educators and communicators that understand these intersections, I think social media is another really great platform to raise awareness and kind of access, especially younger people, where they're getting a lot of that information. And so I think leveraging groups that exist and serving as partners and providing them resources that they can then run with. And they're often wanting that. They just don't have the capacity to find those things themselves.
That's very fair. You've highlighted so much in this presentation, which has been so lovely. You briefly touched upon it. I was going to see if you can kind of add more information to this, is climate change, mental health. These topics hold a lot of opinions and energy. Some have a lot of stigma around both of these. How do you recommend kind of navigating that space? And also, have you been in that space, and how do you work with communities? What terminologies are you using? And how would you encourage someone kind of working in that space?
Yeah, I mean, I would say my background as a mental health provider, I've worked with many patients that are coming from cultures and contexts, whether are other parts of the world or more rural settings where mental health is stigmatized, where the word climate change is not something people are receptive to. I would say you don't need to use language around mental health to explain the effects of these events. You also don't need to say climate change to talk about these events. So you can just say, I'm sure you've noticed that it is getting hotter during the summers. And I'll even bring in when I'm working with patients, when it's really hot outside, I notice that I can feel grumpier, I'm more tired, I'm not seeing my friends as often. These are all things that I think people can relate to. They're not bringing in any of these stigmatized language, but they're really offering opportunities to start making these connections and help people identify both what's happening in their physical environment, how it's impacting their mood, and kind of start planning about what they can do about it. And so I would say just trying to use like language that's not stigmatized or politicized is actually really possible in these contexts when we're just thinking about these events we can see and are all witnessing.
I appreciate that. That makes a lot of sense. I had a question too, is like, we're in the springtime, and we're slowly entering kind of what is typically in Washington State, this extreme heat weather, with wildfire smoke in a couple months. This is a really great time for the healthcare system to prepare. What are a couple tips you may have for the healthcare ecosystem to get prepared?
Yeah. I would certainly say like starting to add into the resources that you support to patients, information on these links. So when we're thinking about, I remember getting so many alerts about COVID-19 and how it was impacting people that have pre-existing health conditions or being immunocompromised, and kind of plans for how to stay safe. If we can use similar alert systems or like patient awareness to start spreading information about these intersections. I also think just starting to create information sheets that are in clinics that people can kind of see and pick up. So often when I'm waiting in a healthcare office, that's something that I go to. If it's not happening there, what can we be sending out in my chart patient portals or the equivalent? So I think really this public awareness education, like starting at those points, just so people start making these connections and providing real solutions in that. So we know that this is happening in our area. These are places where you can get an air filter. This is how you could make a low-cost air filter at home. Kind of starting to think through what are the concrete things we can be telling people in these public awareness campaigns.
Yeah. Share my screen. We're looking at the time. We'll go ahead and start wrapping up. In the chat, you saw that there's some post surveys. We're hoping you can complete and provide us feedback on your experience. I will also be working in the next week to send you a video recording of the webinar today, along with a PDF copy of the slides. We have a handful of events coming up within the BREE collaborative space that we'd love to invite you all to attend. They are free, virtual, similar to this. We'll be looking more into measuring change and how you can use some of our BREE tools, focusing more on perinatal behavioral health and how a group has been working to do that. And then in May, we have a webinar on the collaborative approach to adult health, looking through different key aspects to adult care. We previously did one on youth this past winter. And we also have a brief hot topic event on AI and healthcare, current trends and future directions. So if you'd like to join us, we'll send out opportunities to sign up. But we really just want to thank each of you for joining us, but especially McKenna, thank you so much for just sharing your wealth of knowledge, experience, all of this lovely work. It is so important and becoming such a critical issue that we're seeing in our state of not only how to address these weather events, but the impact that we see on mental health. Again, I think so commonly we highlight the physical health where you can physically feel like, hey, I'm tired, I'm exhausted, I'm really, really warm. It's hard to breathe, but it's sometimes we don't always think about the mental toll of that, of, hey, I can't go outside to see my friends, my family, to do the activities that keep me healthy. And so I really appreciate you giving us a really comprehensive overview of this and spending some time with us today. But thank you so much. And again, thank you everybody. And we hope to see you at another future event.